A lot of people talking about these big changes coming to the state health plan. It will no longer cover prescriptions for weight loss drugs. That comes as of April 1st. The plan's governing board, they had decided last fall not to cover any new prescriptions this year, but now they voted 4-3 today to end coverage of existing prescriptions as well. WRAL Capitol Bureau Chief Laura Leslie was at the meeting at the state treasurer's office.
We're talking about popular weight loss drugs like Wegovy and Saxenda, also called GLP-1 drugs. The state health plan leaders today said they've tried everything they could to keep those drugs available for people who really need them for medical reasons. But they said the drug maker has been unwilling to negotiate, and meantime, it's breaking the bank.
I think that whatever issue we're trying to address is only going to get worse financially.
State Treasurer Dale Falwell says the state health plan is already in deep financial trouble. It's expected to run out of money by 2026 unless changes are made. Weight loss drugs like Wegovy cost the plan more than any other drugs, 10 cents of every dollar it spent on prescriptions last year. The number of members using the drugs went from 5,000 members at the start of last year to 25,000 by December, and it was projected to keep growing. Anything the health plan proposed to limit that growth was rejected by the drug maker Novo Nordisk. If they implemented any limits at all, the state would lose its rebate on the drug, making it even more expensive. When the state health plan voted anyway to stop covering new prescriptions, it lost the rebate. So covering existing prescriptions will now cost $54 million more this year unless Novo Nordisk changes its mind. Falwell said the drug maker has basically refused to negotiate.
I don't think they really have any interest in helping us solve our problem long term.
Artis Watkins leads the State Employee Association. She said it's wrong for one company to have that much power.
That a company that produces medication here in Clayton, North Carolina and in Durham, North Carolina turns around and puts a price tag 4 times what it is in most of the rest of the world. That is an insult.
Board members said they could reconsider or reverse their decision if Novo Nordisk and pharmacy benefits manager CVS Caremark are willing to renegotiate the price of the drugs. We received this statement from CVS Caremark spokesman Phil Blando, who put the blame squarely on Novo Nordisk. Drug manufacturers need to stop dragging their feet and agree to offer their medicines at a fair price to North Carolina's public servants. Laura Leslie, WRAL News, Raleigh.
And more on this story. Just minutes ago, a spokesperson from Novo Nordisk sent us this statement saying, quote, denying patients insurance coverage for important and effective FDA-approved treatments for obesity is irresponsible. We urge Treasurer Dale R. Falwell and the North Carolina State Health Plan to reconsider this decision and put patients first. We should also say another caveat. Plan officials say that they will continue to cover the drugs as directed by doctors for patients with diabetes.